All right, hi, welcome everyone. My name is Tim Keeley. I'm the Principal Physio of Physio Fitness. Hopefully you'll get a lot of information about shoulders, the anatomy, how it works, what you're going to do about it to try and get it better if it's a little bit niggly, but also trying to put in some things in your life to try and give you some long-term injury prevention down the track when we all get older, try and keep it from getting injured, keep it going. I've been practicing since 1999, 8, very long time ago. So I've had about 25 years experience of rehabbing injuries, doing sports teams, doing the everyday athlete, doing corporate people. And what I've found is my passion is surgery. So rehabilitating people that have gone through the injury and then right through the surgery and then getting them back all the way back to the start again. That's what I love. It's also what I've gone through, so that sort of helps. I've had a shoulder recon myself, and that was in 2019, and I've had a knee recon, and I fractured my knee last year, I fractured my ankle this year, I've done lumbar spine disc bulge this year, so it's all happening. But what I find is that really helps me, in a way, to understand what you guys go through to get you back to the level where you want to be. So trust me, you're getting first-hand experience of someone who's had a shoulder problem and knows what to do. Today's session, we're going to run through 3 sections. The first one, I'm going to refresh you all, if you don't know, about some what we call functional anatomy. How, not just what body parts are, but how they move, how they work. Okay? To give you an idea of what's going on with the shoulder, so you get a better understanding. Then we'll go through what you call a Physios assessment, sort of. I'm going to give you an idea about what you guys need to look for in your shoulder. When you're exercising, when you're training, when you're looking in the mirror, what are you looking for in your shoulder to see if there's anything going wrong? Because that's usually the first step. We can get you guys understanding how your shoulder works and then spotting little things like, hey, that doesn't look quite right. Even if there's no pain, then that's the first step in injury prevention. So it's really important that you understand how that works. Otherwise, you're going right up to pain and then injury and then coming in to see us. So I'd rather you sort of had some tidbits and ideas and some knowledge of what to do and what to look for prior. Then we'll go through some special tests. So I'm going to get one of our physios up and I'll show you what we do in the clinic when something is painful or not moving and not right, and maybe you even spotted or your trainer spotted in the gym, and then you come in to see us, what we do to test out further what's actually going wrong on that shoulder. So there's a few things we're going to show you there. And then we'll go into our sort of the thing that you probably came here for in the first place, is getting those exercises. What do I need to do to get my shoulder performing better? Injury prevention down the track so I don't get injured when I go to the gym. What things do I need to put in my life, in my gym routine, in my home workout, that'll help my shoulders? Things that are not just push-ups and pull-downs and presses. Other little physio exercises that most people don't do. Right? They don't do them because they haven't been taught them, they don't know what they are, they're pretty boring, and they don't feel like strengthening. But they form the foundation and build up little problems in the shoulder, so when you're training you don't run into a problem. All right, so these ones are going to be essential for you guys if you've got a little niggle, or if you think your shoulder's not strong, like you feel like it's a bit weak. These are the exercises that we give our clients that you can take home today to put into your program. And I'll categorize them into workouts. So we'll do some live demos of what we do with the exercise. I'll show you what actually every single exercise what we do. There's going to be 9 of them. And then I'm going to put them into categories like, okay, this is what you can do on this day, this is what you can do on that day. Because that's quite important. Rather than having 9 exercises, go, oh, what am I going to do with those? Is like, well, you can split them into different days. Because remember, this isn't about rehab from an injury. That's a whole different thing. When someone comes in to see us and we rehab an injury, give them a program, that's a whole different, trajectory. This is about injury prevention. This is about what you can do ongoing. So it may be once a week, maybe twice a week, maybe once a fortnight, that you're doing these exercises to try and look after your shoulder. All right, so it's important to learn when you need to do them. Let's have a look at the shoulder. Let's start off, strip everything away, go down to the bones. What are we dealing with? The shoulder, they actually call it the shoulder complex. It's not just made up of ball and socket joint. There's a few other things going on. We've got your humerus, my arm bone here, and your scapula here. Right? You've also got your collarbone, which we call the clavicle. So they all connect together to make up the shoulder complex. Now the interesting thing about this shoulder, the only anatomical bony connection of this shoulder, my shoulder here, the only thing that's keeping my shoulder on from a bone point of view is that joint right there. Right? That's the only connection back to my entire skeleton. So you're thinking, how does that work? How does it pivot on that? This whole shoulder is muscle suspension. Okay, this is why it's so mobile. I can do all sorts of things with it. And it's designed that way. We want this shoulder super loosey-goosey and heaps of movement so we can do all this sort of thing, but we need it stable. So this is almost totally reliant on muscles. So if they go out, then you've got a problem. All right? Sometimes knee is not too bad. You know, it's pretty stable. There's lots of connection there. It gets worse if you don't have much muscle, but this really gets bad if you have weakness or if you have injury. And that's why people struggle so much, because they have to keep everything in check. If this is a suspension system and one side goes out, then the other side has to compensate. All right, so you have to keep it in equilibrium, and that's tough. And that's why we need to do exercises for it. So think of it a ball and socket. It's not really, though, a socket. If you look at that, there's the ball, but can you see how the socket is really just a bit of a dish? Right? It's not really, think of it like an egg in an egg cup. It's not really an egg in an egg cup, is it? Right? It's not really that. It's actually an egg sitting on a little dish. Okay, and we'll go through what keeps that on that dish. Well, that's the important stuff. But it's designed like that so I can move it around a lot. If it was locked in a cup, I wouldn't have much movement. If you think about your hip, you don't have a terrible amount of movement compared to a shoulder. I can't do that with a hip unless I'm, say, a gymnast or a ballet dancer, right? So we need it loose in the joint. That in itself is like pros and cons. Good, because I can do this, but not good if I'm not very stable with my muscles. Then you've got a roof up here. Okay, that's the acromion and the collarbone coming together. Now that top part is your AC joint. You might have heard of your AC joint where people, oh, I've sprained my AC joint, I've popped my AC joint. That one there. Now if you do that, say if you're a rugby player, you pop your AC joint and injury, that can become a problem because that's connecting, you know, we talked about the connection to the shoulder, from the shoulder to the spine. If that's disrupted, then you've got movement problems going on here. Okay, so another really important one. And these all work together. Like, I can't move this thing around, but even though they're joints, they all move. They all allow me. So when I move my arm, there's movement in the joints to allow that. It's not just ball and socket, okay? It's ball and socket and shoulder blade. And we'll go through that movement pattern down the track. And then you've got all sorts of ligaments. You've got things like bursa that sit in there. You've all probably heard of bursa. If you've had injuries, they've had bursitis. There's a bursa that sits in there. Now that is a little protection thing. Think of like if you go to Coles and you get a plastic bag to put broccoli in. You know those thin plastic bags? It's like that sitting in there with a bit of oil in it. And it allows me to slip slide my shoulder around. All right? But there's not much room for it. You can look on that roof there. There's not much room going on. Okay? In fact, there's almost none. So it all slides perfectly when you're perfect, but when you're not perfect, or your shoulder's in a funky position because of weakness or overuse, then that can get irritated, another cause of injury. All right? So, ball and socket. The other thing is your long-headed bicep. Now that, if you look on this one, is this thing in the front. And it can be a source of pain, can be a source of injury, but the mechanism, you can't see it on that one, but the mechanism of this is also about keeping that ball in the socket. We'll talk about the muscles in a minute, but the long-headed bicep is a little tendon that goes right up into the joint. Attaches onto this bicep, but it gives me stability in the front. If we put some muscles on you, this is like not in any different layers. This is a diagram just showing you a few things, but it gives you an idea of, okay, well, what's pushing and pulling that shoulder blade around? All right? Now, you can't see any of those muscles on this one because this is just the shoulder blade. But if you imagine, can you see the top one is my trap? Oh, let's go back a bit. The top one is my traps, okay, trapezius. Goes from the shoulder blade, or goes down to your back, goes right to the back of the skull. That one, most of its job is elevations, lifting that arm, okay? But it's also got a role to move the shoulder blade and stabilize. Think of muscles. We talked about how that whole shoulder moves. You need stability. These muscles act both to move it and to hold it. All right? So if I'm pushing and pulling like this, that muscle's working to a level to keep it in a certain position with all its buddies. So you've got your upper trapezius, you've got a middle trapezius halfway down, and a lower trapezius, that big triangle going down. So think of the upper trapezius doing this, but the lower part does that, pulls it down. Sometimes when people are rowing and pushing, and their shoulder does this, it might be because one part is too strong and the other part is too weak. And these are part of the movement pattern problems that you're going to see we're going to go through of what you guys need to look for. The rhomboids on the angle there, they're going to pull backwards, do retraction. They're the ones that help you. When you do a row, they're going to help move the shoulder blade back. So if you're doing a row like this, you're going to use your bicep, you're going to use a bit of muscle at the back, you're going to use a bit of lats. But what's moving the shoulder blade back? Okay? It's the rhomboids that move the shoulder blade back. So this is like the deep system going on here to help the shoulder blade, and then you have an outer system that moves the arm. The little one down on the right there, well, it's not really little, it's one of the most important ones in your shoulder, and that's serratus anterior. That's the one that most people have problems with and get weakness with when they get shoulder pain. And that's the one that you'll see goes weak and makes people look like they've got a winging shoulder or a drop shoulder. We'll go through that one in a minute. But serratus anterior is the one that physios and other health professionals focus on quite a bit to improve your shoulder stability, because it's one of the first ones to get weak when you get injured. And most people don't know where it is, they can't see it, they can't feel it, they don't know what it does, because it's very sort of, you can't feel it, if you like. Okay, you can feel your bicep when you squeeze it, but you can't feel your serratus. And one of the reasons is because it sits underneath the shoulder blade. You can't even see it. Unless if you've ever been to a boxing fight and someone says, here's the winner, and I usually can see it down here like a bunch of bananas coming down here. Because boxers, it's called the boxer's muscle, have a very big serratus because they need it to punch forward. What it does is it moves that shoulder blade forward. You probably think the pecs move my shoulder blade forward. The pecs don't move the shoulder blade forward, well, apart from pec minor, but the big pec major, that's attached to your arm. So it moves the arm forward, right? The thing that moves the shoulder blade forward is the serratus. So it's underneath here, contracting to pull my shoulder blade forward, right? It does protraction. So think of the serratus one as the opposite to the rhomboid. Rhomboids pull back, serratus push forward, okay? Then you've got your, what I call your outlay, your big boys, the big muscles. They're the ones you guys train in the gym. They're the ones that you use in sport. They're the ones you see, okay? And most people think that that's all there is. Pecs, delts, lats, right? Or you might see the traps, you probably thought of that one before, but these ones don't attach to, or don't move the shoulder blade, okay? Your deltoid goes from your shoulder blade but to your arm, so it moves your arm. Your lats move your arm. Your pecs move your arm, meaning this one, okay? They don't do any movement of this. Now this gets quite confusing because you're like, hang on, we've got two sets of muscle systems here. We've got a smaller, sort of thinner, lower level muscle system that's controlling the shoulder blade and the ball and socket. I'll come to that in a minute. But you've got a big system that's moving the whole arm around. If you look on this little model, you can see they've drawn attachments for you. There's your deltoid attachment, there's your pec attachment, and there's your lat attachment. Can you see they're all on the bone? Okay, so they're moving this arm around, but they're moving it way down here. So my pec's attached down here, my deltoid attached, they all attach on this part. Right? So when I push and pull, they're moving a bone, a long bone. Okay, well, what's keeping my ball in my socket? If they attach the long bone, they're not attached to the ball in the socket. What's keeping my ball in my socket? What's keeping your ball in the socket is your rotator cuff. Now I've got an image on the side, but I've got this for you. Your rotator cuff consists of infraspinatus, your subscapularis was on the inside of my shoulder. So that's my shoulder like that. That's on the inside, if you can see that. Your supraspinatus, you probably heard that one before. That's right at the top. And your teres minor, which is that one. So there's two lateral rotators. Now, those ones, they call them rotator cuff because they do rotation, yes. Their primary role, if you look at that, they're coming in on top of the ball. They're like a grappling hook to hold that ball in the socket. Okay, so its primary role, when you think of, I'm doing my rotator cuff exercises, the primary role is to keep that ball centered in that dish because the socket is all loosey-goosey. There is a capsule and it comes over, but the rotator cuff come over and hold it and pull it into that. Okay, so they come right over and pull in. So they're super important as far as movement and stability. So if I raise my arm up, if I press, or if I pull, that's all the big muscles attached to the arm bone. What my rotator cuff does is works completely in sync with that. So when I press, it holds the ball in the socket. When I pull, it holds the ball in the socket. When I press up, it keeps it all perfectly centered. And it all does in the background through your brain. You don't even have to think about it if it's working correctly, right? If it's strong and everything's in sync. If your infraspinatus strength is matching your supraspinatus, if they're all working well, then that ball will sit beautifully. If one is out, it's like if one wheel of a car is out of alignment, you're going to start having noises and problems, okay? So if you have an injury to your shoulder or an overuse or pain and one muscle starts getting weak, guess what's going to happen to that ball in the socket? It's not going to sit perfectly anymore because it can't, right? That's when you start running into problems. And this is why physios bang on about the rotator cuff for injury prevention, because we know that the stronger that rotator cuff is, the more it's going to get held centered and the better that joint movement happens when you're doing everyday things, pushing, pulling, throwing, ball, swimming, boxing. It all sits nicely there, okay? And that's why it's in your programs for injury prevention, okay? So really important one to take note of is that its function is not just rotation. And so when we train it, we're not just doing rotation with it or abduction. We're doing other exercises to help it, its function to keep it centered in the socket. Let's look at potential problems. Has anyone had a winging scapula in here? Anyone had that sort of feeling or seen a winging scapula, heard about that sort of thing? Yeah? So what do we mean by winging? It looks like a wing. It looks like a chicken wing, okay? If you ever get chicken wings at home when you go to get your chicken, the chicken wing is the scapula. We're talking about the scapula, this thing here, okay? Is that sitting flush on my shoulder blade? Or is it sitting, if you look at him, off on an angle? What you see that point down the bottom, see the left, it's looking pretty flush. See on the right, you can see a shadow there at the bottom. That shadow, instead of sitting like that, what you see is that, poking out of the skin like that. And what it means is he's tilted out like that. Now when we see that, we go, I know what that is. For you, that is usually the serratus anterior letting go. So the serratus anterior muscle comes in here and keeps it flush and keeps it flat. What's happening is it's weak and it's just letting it go like that. Other muscles are pulling it out of position. Okay, other stronger muscles are pulling it like that. So he's going to have a bit of a problem when he raises his arm because already when he's sort of here, it's sort of sitting out like this. So winging scapula is like that. Now you can have different things. You can have winging that goes this way and you just see the lateral border here. You see a big line going down there. Or you can have winging going that way. What that does, if you look from the front, if you look at the level here, if I wing the scapula, look what happens to the top of it. It looks like it's tilting, right? So look from the side, does that. And this is where we see a tilting scapula, okay? And sometimes that can be because things are too tight in the front. And over time, if someone has that and they don't get it treated, they don't do anything about it, it's a bit sore, they keep, carrying on with the gym, the body starts compensating to try and get out of pain. Okay? It'll tighten things up to try and get out of pain. They start getting worse and worse and worse. So if something's letting go, remember that it's like a tug of war. The body will go, okay, I'll tighten that up to keep them stable. Because if this is my shoulder and I become unstable, the body is clever in trying to help me, but it can't do it via strengthening. You don't self-strengthen. The body doesn't just like grow and strengthen. You have to stimulate that. What it can do is stiffen muscle tissue up to protect itself, or change muscle tension to give me stability. So if I'm losing stability in my shoulder, it's getting a bit unstable. Remember, my shoulders is just muscle attachment, so I'm only getting stability from muscle. If I lose some of it, the body has to tighten areas up, and that gives me problems. That keeps me stable, but it stops me allowing me to raise my arm above my head and do all sorts of things. So very important that we notice that sort of thing, because there's compensations down the track. There's problems that will lead to injury from that sort of thing. Now, some people have a little bit of winging scapula, okay, and they go through life fine. But for me, it's like, is it on one side though? Right? Is it normal for you? Is something happened, you hurt your shoulder and then you notice this? Because that will then lead to a problem. Okay, and you're better to address that and try and get that better than just leave it, even if it's pain-free. Because remember, we're trying to get you before the injury. Okay? So there's also, you can have an increase or a decrease of scapular elevation. Some people start having a high shoulder, right, where it's too overactive. And maybe they've had pain from a neck problem going down into the shoulder blade, down here, and they've got issues of pain there, which has made this muscle work harder to try and stabilize. They've got an elevated shoulder. They might have a drop shoulder because it's switched off due to neck problems. And sometimes we see these issues. It might be, I've had a bit of a sore neck. And we go, okay, well, you're now going to get a shoulder problem if you don't fix that. So one thing can lead to the other. And we see people that come in with shoulder injuries and they've got a dropped shoulder or a tilted thing, and you go look back in the history and go, yeah, I've had a really sore neck for the last 3 months. And now you've got a shoulder injury. Okay? So really important to spot these things. This is sort of your job and my job. Can you spot problems and mobility issues going on with the shoulder and see if you can pick these things up? Those 3 things are dealing with the shoulder blade. The next thing you want to look at, and I'll give you some recording demo of this, is what happens with the rhythm. This sometimes gets a little bit tricky, but I want to give you guys a bit more knowledge than just, oh, my shoulder's working a bit funky, I better go see the physio. I want you to spot things early, and if they're a problem, then you come and see us and get that assessed. So, an incorrect scapulohumeral rhythm. What that means is, when I either raise my arms up, or I'm doing presses, or I'm doing pulls, there's an incorrect movement pattern. Now, I'm going to give you an idea of what one would look like. We're going to go through some scenarios. This is a drop shoulder. Okay, so you can see her shoulder, I can correct her, and then she just drops it. So her resting tone of her shoulder is very low. She's very clever though, she can sit it up into there, but this is showing you like what it would look like instead of being upright and back, if it's dropped forward. You can see on her, can you see the angle of that shoulder blade? Okay. Now most people will find that's not a problem. But what her shoulder blade does is it sits like this. Okay. That's not ideal most of the time. Right? We want it more like flat. If you're sitting in normal posture, we want it a little bit flatter than what she's doing. What you're looking for though, at home, in the gym, is one side doing it and one side not. Okay, is one good and one not so good. And this can happen slowly over time. Our desk job, driving the car, the fact that we're right or left-handed. Over time, if things are a little bit different one side than the other, then this is the sort of things that start developing, and they come out of the blue. And people go, oh, I've got this shoulder pain going on, what's happening? And it's happened over a long period of time. But you can spot that sort of thing early on. The rhythm issue, if you watch this carefully, she's going to go up into abduction and that's looking fine. But what happens when she comes down? Do you guys see that? People go, oh, what's that going on? So she can raise her arm up totally fine. She has a few movement issues, but when she comes down, whack. Can you see how that shoulder blade moves far too quickly? Even if you're not physiotherapists, you can see that already. You go, that doesn't look quite right, does it? What's supposed to happen is she's supposed to raise her arm up nice and evenly and then nice and slowly down. But what's happening is when she gets down a certain point, that's just letting go. Now, we know as therapists there's a weakness issue doing that. There's something catching in her shoulder or some sort of pain that's triggering her brain to quickly get down and get away from that pain. That's what's happening. Okay? And there's a weakness issue. There's just inability to control. When she raises up, she's forcing it to turn on. But if this one here, if I can do this, her at the bottom, her shoulder blade actually sits inwards. And we see this quite a lot with people. If I just stop that for a second. We see that with people that when they raise their arm up, this shoulder blade is supposed to stay still for the first sort of 30 degrees, even up to 60 in some people. So it's not supposed to move. When she raised her arm, her shoulder blade did that. So she's already, it's coming out and doing this, and then it's forcing her to come up. But what happens is if your shoulder blade moves in before you even move out, you have to try and get all that range back. And what happens? You can't. And so you have to try and get it out of your shoulder. And you go and catch your shoulder. So to try and do a shoulder press to full range, if you don't have good stability at the bottom, at some point you're going to go and do some compression at the top. You're going to get up there and try and do that to it. Now that's fine for a while. Most people get through life fine, but then all of a sudden it becomes a problem because you're compressing that. We call this impingement syndrome when it becomes an injury. And there's various things that can get injured there. Tendons, bursts, all sorts of stuff. But it starts with what is happening with the shoulder blade. What is happening with that movement? Is that movement going correctly? Some people can stay still, and when they raise their arm up, they get there, but they just don't have enough power, and so they still can't get up high enough. We need about what we call 60 degrees of rotation of this shoulder blade. To get my arm up, this shoulder blade has to move about that far. And if it's not going to do that, I have to get out of here. But that's not designed to do that. This is designed to only have 120. So when I go from 0 through to 180, I need 60 degrees of that and 120 degrees of that, and then I get 180. So if you look at that, if I bring my shoulder down, I'm actually only got 120 there. Does that make sense? So when you think of raising your arm up, it's not 180 degrees in the ball and socket joint. And maybe in some extortion people can be really bendy. It's 120. I get it by doing that. So if this is not doing its job, this is where you're going to run into shoulder injuries. So that's why we bang on quite a bit out the shoulder blade. That's why I started with it. Because it's so important to get this movement pattern right. It's so important for you guys to spot the movement issues. Is it moving correctly? Is it moving out? Is it moving in? Does it look winging? Is it a bit weird? Because that's going to be forming the base of whether you're going to have a shoulder problem or not. Okay? When you raise your arm above your head. And let's face it, that's what we do in life. That's when we usually get injured, pushing forward or pushing up. Most people don't get problems pulling. It's when they push forward and push up, when that ball wants to move around in the socket. Okay? The last thing we want to look for, and what you guys will easily spot, is a painful arc. And that's when you raise your arm and you do have pain. Now this can be the point where you're sort of getting close to injury here. This is where you need to pick this up and not go, oh, that's just a bit of a sore shoulder. If you've got pain in your shoulder, something is going wrong. And I don't mean just fatigue because you've been pushing a lot of weights. I mean, when you raise your arm, I go, oh, wow, that's a bit sore. And it may start around about here and start at that point there, and then it might even go away a little bit. And you go, okay, it's not there anymore. And then you go, oh, there it is again. Now that's an indication for us that something is sore. But I'll break this. Something is sore when you go through here. Okay, when that ball rotates and these tissues go through the socket like that, something is getting compressed. Something's getting maybe swollen, something's getting tight. So a painful arc, whenever you're doing something here, lifting your arm forward, raising it above your head, that is something that you guys need to be aware of, probably get assessed straight away, so you can quickly work out what the problem is and work out what you're going to do about it before it turns into a full-blown injury. Last thing on this section, a loss of range. Now, you may see some people can put their hands behind their back really easily. Some people can only get to here. A normal hand behind the back movement, which is internal rotation, it's talking to me. We want to get your thumb to between T5 and T10. Now, what that means is the 5th vertebrae to the 10th vertebrae. So up your back. So this is not high enough. Okay, you need to be at least here, if not between your shoulder blades. Okay, for normal range of movement. If you don't have range of movement, if you go, yeah, I've got a hand, that's fine, and this one go, oh, it's just so tight, I can't even get my hand up. You're going to start running, you've got range of movement problems, which is going to be something that you need to think that could lead to an injury. If I have it on one side, not being able to get my hand up around behind my back. This doesn't mean about the people who've had surgery and things like that, who are trying to get their hands higher and higher and higher. This is pre-injury, what we're aiming for. The other thing is a loss of external rotation. Now this one is one of those, if you start losing external rotation range, this is where you get real problems above your head. So what I mean by that is you should be getting the same amount left and right. Okay? If you look at that and you go, how far can that one go? Can it go so at least for 50 degrees? Can I get 60 out of it? Some people have like 80 because they're really mobile. And you look at the other one and goes, oh, I don't have enough there. How much range have I got? That'll be an indication that you're losing range somewhere in the joint. Now that could be all sorts of things, but something you probably need to get as to why you're getting range of loss there. It could be their brain's trying to protect you through wear and tear or an injury starting, that it's trying to sort of stop you going that far because you get unstable if you go that too far, if you've got weakness. So remember we talked about how your brain doesn't strengthen up, it tightens it up. So to protect you, if you're starting to get weak, or you start to get some wear and tear, some cartilage loss problems, it'll actually tighten you up to stop you going into the range that it doesn't want you there. Okay, because it knows that you're going to get sore if you keep doing that. But if you don't have that range, you won't be able to do that. Okay, because you need external rotation to get your hand above your head. One way of working it out is, if you're at home, you can put your hand up against a wall and go and see if you can get to 90 degrees. Okay, you need 90 degrees. So if you go to the other side and you're going, oh, and you have to compensate to get it there, you're having problems. You might find you got it here, but in my books, you also need to get it there. Because guess what? That's where you shoulder press. So if you don't have that, your brain's going to have to find a way to get you there, and it's usually going to be non-ideal. Okay, so when you press upwards, if you don't have that full range, you're going to start running into problems here. Okay? And it definitely decreases when you get injured. So if when we get people that are coming in and they are injured, and they've got impingement syndrome, they've lost that range there. Maybe not by this much, but they've lost some of it. And to get them right, we need to get that back. Right? So your job is to try and spot that. So when you come into the clinic, you think you've spotted mobility issues, usually people come in pain. We'd love to have everyone come in pre-injury. That would be awesome. But we don't have that luxury. We do some special tests to see what's going on. All right? Now, the empty beer can sign, Pam corrected me, it's the empty can sign. I called it the empty beer can sign, and it's maybe just a university thing. But anyway, what we're aiming for is to get the person from here, see that 0 there, and come out about 30 degrees there. Then what we're going to do is let them rotate down, all the way down to there, and try and hold that, and she's going to try and resist me. So I'm going to push down, she's going to try and push up. Now what that's doing is testing her integrity of a few muscles, but namely supraspinatus, okay? If she has a pain with this, push up for me. If she goes, oh, that's really sore, or I can push down. If I go on the other side, and she try and push up, and she's way stronger, if there's a weakness there, I know there's something going wrong with that rotator cuff. Okay, so it's one of our little tests. There is some specificity, but what we have as tests may not totally diagnose, oh, it's a supraspinatus tear, or it's this. What it tells us is there's something going wrong that needs to be either strengthened or looked at further through imaging. Okay, so that's one of the tests we do, and one of the major ones we do. Second one is a Hawkins-Kennedy test. Now, what you do with this one is we get them to 90 degrees like this, okay? And then what we do is, once we push them up there, is crank them this way and see what happens. And some people, that's totally fine. Pam's pretty mobile, she has no problems with that. But this one, we'll see whether she's got any impingement signs in here. Okay, so is there something in there that's giving her pain? And that could be bursa, it could be tendon. You know, is there something that will elicit that same response? Okay, so there's our Hawkins-Kennedy one. Your O'Brien's, we're specifically looking at problems with the labrum. Now that could be a bicep problem, a slap tear. This one, we do the same position, the one we did with the empty can sign, but we come right across here. Now what this is going to do is stress that, we talked about that bicep tendon at the start that goes through the front of the shoulder. It's going to stress that anchor point. So it's going to stress the labrum. So this one, if this one's positive, push up for me, and they go, oh, that's really sore, or there's heaps of weakness on that, then we know there's some issues going on there. All right? You can see how a lot of these things are long lever. Okay, when that we're really testing out, can that ball sit in the socket? But if it doesn't, okay, then it elicits pain, then we know there's some massive weakness going on there. Okay, it's not just, oh, I've got pain from my neck or pain from something else. We can test whether structures are actually weakened or a little bit damaged. Right? Speed's one, again, long lever. There's the fourth one that's long lever. So out here, you're going to have your hand palm facing up. We're going to push down. She's going to try and resist this. Okay, and again, is this giving her pain up into her shoulder? Is it a labral problem? Is it maybe it's a bicep problem? What we can do, if they've got significant injury, and there's a sort of common rule that if I push up on that, and that's painful, and then she does this one, and that's painful, and then she does this one, and that's painful, there's something injured in there, right? Okay, that's not normal, especially if we go to the other side and everything's fine. Right? So there's certain things that we can go further. You can spot the movement problems, we spot the movement problems, then we can test it out and see whether, have you got a strength loss? Have you got pain response to when I load the tissues? And then we go deeper and further with that. The other one is external rotation strength. You face me for me, Pam. Mm-hmm. The external rotation strength one is where she goes in that position and she's going to push out when I push in. So if I push in for me, push out, I'm going to push as hard as I can in there. She's got to try and resist me. And I want to see, is there pain? Is there weakness on one side versus the other? Okay, so if I see she comes and goes, my shoulder blade's winging, I've got a little bit of a niggle with my shoulder, it's not quite right. I push and pull, it feels a bit wrong, it doesn't feel right, there's something, have I got injury? And I see the movement pattern problem here, but then I test her, she has no pain, but she goes, boo, it's really weak. Okay, we know that she's lost strength in that. And this is where, okay, part of a rehab will be obviously strengthening up, but we use these tests to make sure and diagnose exactly, are we on the right track? What are we going to give that person specifically in her rehab program to try and improve that area? For you guys, I'm going to give you a whole lot of things to do as injury prevention. But when they come into clinic with specific stuff, we have a specific program. They go, okay, you just need to do this, this, and this. Because I'm not going to give someone 26 exercises every time they come in for the same thing. And then passive abduction. So we usually do this lying down, but what I do with Pam here is I'll hold her shoulder down and push her into abduction. Okay? If there's a structure that's in there that's giving her pain and is swollen, I'll be able to pinch it and see if it gives her a problem, especially compared to the other side. So hold her down, push her up. Does she have any problems there? Has she lost some range in abduction? Okay, thanks, Pam. That's awesome. So that's just a little insight of what we do. And those tests are really important to help sort of keep pushing us in the right direction as far as, from physiotherapy point of view, what are we diagnosing you with? Because we can't send everyone off for an MRI. And sometimes MRIs or ultrasound scans don't give us the full picture anyway. They don't exactly always show pain. They might show injury, but that injury may not be related to that person's problem. So it's very important that you do testing and assessment first and then work on a rehabilitation program, because at the end of the day, if it's weak, you've got to strengthen it. And most of the pain from an injury is usually due to dysfunction from that weakness or that tightness. So the way we get out of the pain is, okay, I need to get that rotator cuff stronger to do its job. So think of like, if it's lost its job, you're going to get pain. So I've got to get it strengthening to get its job working, and then that person's pain will come down. If it's simply from a dysfunction point of view. And even if they're injured, if they've got other tears and that sort of thing that they're not going to go to surgery for, guess what's going to happen? They're going to have to do strengthening work. So they start with a physio. Let's break it down in exercises that I think you guys should do in your workouts forever, right? And these are taken from exercises that we give our clients for specific injuries in the shoulder. Okay, so I could give you 50 exercises tonight, but I'm not going to. I'm going to give you 9 because I think they're the 9 most important ones for you guys as injury prevention. And we split into 3 lots of 3. So for those of you who are going back into the gym or do workouts at home and you do a push or chest day, meaning everything going forward, right? These 3 are really good to do for that day. And what I suggest with all of these is you do them prior to your workouts. So think of this almost as warm-ups. What am I going to do before I go and do push-ups and presses and all sorts of things, pushing forward machines and that sort of stuff? What should I do? How do I fit my rehab in? Well, fit it in as a warm-up. Now, this doesn't have to be every single session. This could be once a week, once a fortnight. Right? First one, scapular press. And I'll go through why we're doing this. There's different versions of this. With physios, we can do all sorts of standing ones, wall ones, bands, floor, balls. I'll show you what the most simplest version that you guys can do at home is. Now this one is working on your serratus anterior for your protraction, because we want that strong. It's also working on your rotator cuff stability. So when you're in this position here, like in that diagram, you're on all fours, okay? You're going to do retraction and protraction, but you're going to do it one-handed. Because when I'm with 2 hands, if I say I've got my weakness on my left, if I put my right hand down, then that's giving me stability. The whole thing about the shoulder is I need to increase my stability. If I put my hand there, it's cheating. So I need to be able to do that movement and hold myself there. And I can just put my hand where I want. But I've got to now go through retraction and protraction in one arm. And what that's telling my brain is, if I think about, can I keep stable here? I have to use that muscle not only to push forward my shoulder blade, I have to use that muscle to hold my whole body up, right? Because my shoulders hang on muscles, so if I plant my hand, if I don't use it correctly, I'll just drop through there, okay? So there's 2 things I'm working. I'm working on strength in the protraction, so I use the retraction, protraction movement, but because I do it one arm, I'm also teaching that muscle to stabilize my shoulder blade and hold it in position, okay? Simply for the fact that I'm on one arm. Now, when I go into retraction this way, I'm working that muscle in reverse. So I've contracted it to keep me up, and I'm slowly decontracting it to let go. I'm not actually pulling. Right? The rhomboids do work, so muscles in the front work with muscles in the back to control me. But when I pull with my rhomboids. It's the same movement, right? Exactly the same, but I'm working this muscle, what we call eccentrically, in reverse. So it's controlling my shoulder blade down. So the more I work on just my shoulder blade down and back, I'm improving and isolating that serratus muscle. I'm not using my pec. If you do this at home, you put your hand down, your pec's not working because your pec's attached to the arm. I'm not moving my arm. As soon as I bend my arm, then I'll use my pec. So we don't do a push-up to get serratus better or isolate it. We do a scapular press because if we do a push-up, the big pec's going to take over the movement. It's going to do the job for me, okay? And I'm not going to be able to isolate that. I do this exercise so I can do my push-up. I can do my pressing work. All right? So that's why it's beforehand. The other thing it does is when I place my hand here like this, the ball is setting up in the socket. Okay? When I load bear down my hand, that'll tell my brain to turn that muscle on here. And even though I'm pressing like this and I'm doing serratus, people get fatigue up in here. They can feel their rotator cuff working by just holding on because it's forcing it to turn on. And this is where we talk about the function of that rotator cuff. Yes, it does rotation, but it does stability as its little primary movement, if you like. Okay, and I need that. So how do I get stability? I do that exercise. So it's a really nice one to do for when I want to press and my pecs are moving my arm forward to keep my ball in my socket, is my rotator cuff, and I want my shoulder blade moving correctly. If I press and I don't move my shoulder blade correctly, if I don't move it forward well enough, I'm going to start doing too much movement in the shoulder joint. Like, I need to move like that. So this is what's going to help isolate and work on that movement, okay? So if you were thinking, okay, I've got a winging scapula, I've got a tilted scapula, I feel like my movement pattern's not quite, this is one of the exercises we give people to improve that. And it's one you can do to help improve the strength of your pressing and safeguard you from injury when you press.
And how many reps?
It depends. But for you guys, keep it really, really simple. Can you do 3 sets? 4's probably a bit overkill. 2's not enough. Can you do 3? Right? Can you get to at least 8 reps without fatigue? 12's your limit. Anything past 12, it's too light. So usually in the clinic, they've got to get to 8, otherwise we have to lighten it up or make it easier. All right? Between 8 and 12 is your strengthening zone. Okay, so you go 8, can I do 9, can I do 10, can I do 11, can I do 12? Once you hit 12 again, and it's a piece of cake, and you do 3 sets of 12, you probably need to put some load on. And that's where we make things harder. So we'd do things like this and go, can you do it like this now? I mean, people go, oh my goodness, that's so much harder to do. And you get so much more fatigue. You may only get to 8 on that, right? Or you might use bands to do some strengthening work. So think of that rep range as 8 to 12, yeah? Round about 3 sets on everything. Because remember, you're just doing prevention stuff. So you might do, I did 10 on that set, I did 11 on that set. It's fine. Sit between that range. It doesn't have to be exact, but what I would get exact is about 3 sets, and that's both sides. Now some people, if you want to get really pedantic about it, is you might do more sets on the weaker side, if it can handle it. Internal rotation. Now, again, lots of ways you can do this. You can do it with dumbbells, you can do it with bands. This way is quite a high level one, but remember, this is injury prevention. So someone who comes in here with a supraspinatus tear or subscapularis tear and they can't do that movement, it's too hard, we would dial it down and put it down here somewhere. We'd use a dumbbell, make it very, very light. But you guys need a bit of strengthening. So what I suggest you do is use bands like this. 1 or 2 of these, I'll show you 2 today. You find that if you put this at around about shoulder height, now people say, I haven't got a gym at home, where am I going to attach that to? You can have it lower down on a doorknob, okay? You can have it up on a hook, okay? Anyway, you can put it around a door and shut the door. Anything that you can just have that, it's not going to move. This one goes in one hand, and you can shorten it up a bit to get a bit of tension on that. If you can get your arm up to 90 degrees like that, in that position, you then step forward until you've got enough tension that it's sort of pulling you back and you have to really fight that to keep it in position, and then you're going to go forward like that. Now, that may seem really easy, and you do this and go, oh, that's so easy, it's so easy. What we also want you to do is not just internal rotation strength. Yes, subscapularis here does internal rotation. I can do that without my pec moving, okay? But rotator cuff is about stability. So when you do this, you don't want to just do this and have your elbow doing this. So you see what my elbow's doing? Okay, it's flying around. If my elbow is flying around, I don't have much stability going on. I'll end up probably getting a bit injured when I do that. So I need to pay attention to what my elbow is doing. And you're not allowed to rest on a bench either, by the way. You've got to keep it in mid-space. If I keep this in one spot, I know that in my shoulder joint, it's staying in one spot. I'm keeping stable. I'm teaching my brain, if I can keep that elbow in one spot, like that, I'm teaching my brain stability up here. I'm getting better and better coordination through the shoulder joint, and that's going to go into, when I press forward, it's going to help me keep that ball perfectly sitting and centered in the socket when I press. Okay, so part of these sort of exercises is not just strengthening, it's about improving the function of what or how my shoulder moves, how that rotator cuff holds onto that ball and keeps it in the socket. That's why that's so important. And a lot of people just forget about keeping the elbow still, or they can't keep it. Why can't I keep that elbow still? Because you don't have enough control. And sometimes that's because of weakness. Sometimes they're a bit uncoordinated, or they've had pain that's made them lose some of that control. It's very important to get that back. Okay? So when you're doing that, it's a note for you at home, make sure you're keeping your elbow still. Extension, I love extension. This one helps me keep the ball sitting back in the socket. If you look at the shoulder, I might just take all these muscles off. The shoulder socket is not exactly straight out the side. It's on an angle. So, this shoulder blade sits like this, but my socket's facing that way. So I've got more at the back than I have at the front. I've got more sort of bony stuff at the back. So it's more likely that this ball is going to go forward than back if I'm weak. So if my rotator cuff is not keeping it centered, it's more likely to slip forward. We call that anterior translation. So if I'm going from the side, this humerus here, when I press, is more likely to go this way if I'm weak than that way. So what I want to do is fire up the muscles at the back that switch it on and keep it holding it back. Because we talked about it's not really a cup. There's no bone keeping it locked in the socket like the hip, and it won't dislocate. That's why shoulders dislocate. Because hips don't really dislocate, apart from babies sometimes, because they haven't formed their hip properly. But this socket needs to have muscle control. So if we fire up the muscles at the back, it's going to help keep it centered from a perspective of keeping it back in the socket. So I love extension. Sometimes we teach people just to have it at elbow height, and that's super easy when you want to put it onto a doorknob. So if I'm here, we might have it at sort of that height there. Okay? And that's usually for people who have problems with the shoulder blade. What I suggest you do is have it up higher, because it'll give you a dual purpose with this. Now you can put that on a hook at home, coat hook, something like that, and then you kneel down. What you're going to try and do is extend the shoulder, but you've got to get the shoulder blade in the right position. I don't want you extending with the shoulder forward. You need to pull the shoulder back to there, and then you extend this way. Now it's not a row, because that's using my lats. I'm not going to isolate the back here if I do this too much. My big boy's going to take over. You do lat row when you're doing exercise anyway. What I want you to do is pull back and then go, okay, I'm only allowed to use the back of my shoulder to do that. And then return it and release. The good thing about this one, for us as physios when we give it, is it's teaching people about shoulder blade control as well. It's not just about what's happening in the shoulder joint. It's about how does that shoulder blade move when I pull. And if I can isolate and tell my brain, I want to pull back and stabilize and then keep it stable, I'm learning how to stabilize my shoulder blade and then release, then I'm going to do a way better job when I press and pull. Okay, especially when I press. When I push forward, it's not just going to let go. I've got more control there. I know what I'm doing. All right? So it's a very good prep one to do to, again, not just focus on muscles around the shoulder joint, but also the shoulder blade. Okay? And that working that dual synchronicity between stability of muscles and power. Okay? So chest pull day, that's a good option for you to do. Of course, like I said, there's heaps of other things you could do, but for you guys, 3 is a good number. All right? Do them before your workout, before you go and launch into doing push-ups, dumbbell presses, machine presses, flies, anything that's forward, these are your 3. Shoulder day. Okay? Shoulder meaning that way or this way. Okay? Anything going up. All right? Usually in this sort of plane here. Okay? You can do it for front raises as well, but it's upwards is what we're doing. So, 3 again. my absolute favourite, external rotation. Now this one is like, if you're going to do one exercise for the rest of your life, it'll probably be external rotation. Not that you're allowed to do one, but if you're only allowed to do one, it's like that, external rotation. So this is like working the glutes of your shoulder, if you like. Okay, we need glutes to be able to lift and squat and run and all that stuff. We need our rotator cuff to have our shoulder functioning. So you do this via putting that band down like on a coat hook or something like that, on a doorknob. And for you, I've given you a 45-degree one. And what does that mean? This is 0. That's 90. 45 is halfway in between. It's a lot harder to do external rotation keeping your elbow in mid-space, just like the internal rotation one, than it is down here or up here. Down here it's pretty easy, because lock it by your side and away you go. And you see people doing this in the gym. That might be good for someone who is quite injured, who cannot get up this high because it's sore. I don't want you up at 90 degrees full warm-up, because yes, that works on external rotation, but because the deltoid is all fired up, okay, it can hold you in that position. It's very easy to keep you, because you're lifting, to keep you up in that position. I want you down here, right, way harder. And you'll find when you start going down here, and there's a few things you have to do, like face that band 45 degrees. When you pull backwards, you'll find that, oh, I can't keep my elbow in the right spot. So again, you've got to keep the elbow here and pivot back that way. Because I know that that'll get me my strengthening through my posterior cuff, which is my infraspinatus, and that teres minor, those two muscles there. That'll get me stronger, okay, which is so important for when you're pressing and pulling. But if I keep my elbow in one spot, again, I'm teaching my brain, keep my ball in my socket. Okay, so I'm teaching function here, not just strength. I'm improving how well my shoulder will then move when I do a normal human movement pattern. Okay, so really important that you work on, can I keep it 45 degrees and do that? Don't be lazy and start doing this, or up here, okay, just because everyone else is doing it in the gym. Work on this position, because guess where that position is? That's where you press. Not often do you press like this, or like this. And as humans, we move here. We don't pick up the groceries like this. We pick them up, we move out. Okay, we reach for things this way. Okay, we don't sort of carry the shopping like this. All right? So it's important that you work when you are doing shoulder press and stuff, when we press, guess what? We're in that position. Okay, we press forward into here. So it's important that you are strong in that position. Imagine that's the bottom of a shoulder press. If I'm not strong there, I'm already at a bit of a deficit. If I can't sort of keep my strength there when I press up, I'm going to go forward, and that's going to give me problems when I press. Side sprinter, very similar muscle group working, but now what I'm doing is teaching my muscles to switch on when I go forward. Okay, so this band here is giving me a constant load in the back. All right, so I'm going into the external rotation. I start down here, into the external rotation there, and then when I come up, I've got to try and fight. The band wants me to do this. I'm like, oh my God, the band wants me to pull me this way. So I have to constantly external rotate, but I've got to teach my brain, can I keep it in one line going all the way up like that? Most people will get it pulled inwards, and they'll fatigue quite a bit. You might have to sort of step in a bit and go, okay, I need to take that pressure off a little bit. But learning how to control that movement there will put you in a better stead when you either raise your arm like this or press above your head, okay? Because you're less likely to internally rotate. If you've got more external rotation strength when you push upwards, you're less likely to get injured in your shoulder. That's why we bang on about external rotation so much in physio. It's because it's like one of those first things that you lose, like the serratus thing that you lose your external rotation strength as well when you get pain. Okay, and what happens is people tend to rotate inwards and then cause problems in the shoulder when they do that. So having that ability to externally rotate when you raise your arm above your head is really important. You get it via doing things like this and learning to teach your brain, keep externally rotated when I come up. Don't cheat and let it roll in just because of weakness. So if you can get stronger there, it'll make a massive difference. Now, your last one is your foam roller press. Now you think, okay, isn't that just pushing above my head? What it's doing is it's giving you a bit more serratus firing when you come up. We talked about how your serratus protracts your shoulder blades, right? It also rotates your shoulder blades, so it helps the lift when you come up. So when I press above head, if I've got a winging scapula, my serratus is not working, I want to then work on exercises prior to pressing above my head. If I put on the wall like that, okay, what I'm going to do is start off it down low, like this. I'm going to lean on it, okay, but I don't want to be sunk in into retraction. I'm trying to stimulate my serratus, so I want to protract. So what I do is before I roll this up the wall, I push away. So instead of being here, I'm pushed away, and then I'm going to roll that up the wall like that. And then I'm going to come down, and then relax again. So every rep, protract, so I know my serratus is on, and then it's more active when I raise my arm above my head. Okay, and down. So it's a really nice one to do prior to you lifting above your head. Okay, simple stuff. Back and pull day. Okay, now think of rows, pull downs. Okay, one arm rows. Any type of row that you do where you're pulling. Remember, your bicep and your lats, a bit of delt, is moving your arm, is pulling your arm backwards. You've got to make sure that that shoulder blade is also working in sync with your big muscles. It's usually not the big muscles that get injured, it's the stuff around the shoulder blade and the shoulder joint that gets injured. Okay, so the scapular row is a really good one to do to mimic like you did with the scapular press. We talked about how I'm trying to isolate one muscle group to fire it up. Okay, so I keep my elbow straight instead of pushing. If I do a row and I bend my elbow, guess what's happening? I'm going to engage other muscles that take over. And that's your row that you're doing in the gym anyway. We're trying to do something that's not the stuff you do in the gym. Because, hey, if gym exercises got you better, you wouldn't need physios. So this is why we do the physio exercises. The row, I'll show you this way, is, again, 2 bands, 1 band, depending on how strong you are. Working on keeping your shoulder blade down, not up. We don't want the upper trap doing heaps of work. The upper trap does stabilize the shoulder, but it's also a bit of a bully. So it works, it's like the pecs and the lats, and it's got a bit of power there. And it can take over quite quickly and then all of a sudden disrupt your movement pattern. So you've got to go, think, shoulder blade down before I even start. I'm starting with my shoulder blade forward. What I do is pull that back without bending this. Your brain will want to do this. You'll pull back and you'll, why am I bending my elbow? Because that's a normal movement pattern. It's in the brain here going, let's bend your elbow. You've got to say, no, don't do that. Keep my shoulder down, pull it back. Now I'm going to make that look really easy into that position there. Okay, so pulling back, what you're isolating is those rhomboids. But you're also telling your brain, stop using upper trap so much. Because most people with pain or weakness, the body, like I said, compensates. So it's going to go, okay, serratus is weak, lower traps are weak, let's use more upper trap. Because they want to press and pull and do stuff, I'll have to give them more something else. And that leads to more work here, and they get really sore and tight in the traps. And you see people when they row, they do this sort of thing. Well, one goes up. Okay, well, they can't control it from going up. There's a movement dysfunction going on there. This will help teach you to stop doing that. And sometimes this is a feature of habit. It's just like, I'm just doing it wrong for so long. This will help you get that, okay, this is the movement I need to do. Then when I go and row, I'm not going to go and do that. I'm going to repeat the same movement there. And then when I row through, I'm going to work on that method. Think of it like it's the component of the row. It's this movement here. And when you go and do a row, all you're adding in is your arm. Okay? It's a really nice one to do. Yes? The extension, you're moving your hand. You're doing a row at the start, a little bit, okay? But it's that movement there. Yeah, yeah. It's just that. Yeah, yeah, yeah. And some people who don't have this, then do an extension and do that. Right? Yeah. So you're getting a double whammy with that. If you do extensions and you do scapular rows, it's like you're doubling up on that movement, which is really important for you to work on. Okay, so do both. They do different things, yeah, but they have the same base, yeah. You pull down the foam roller. Now this one is to try and get mostly your lower trap a little bit more switched on than your upper trap. It's learning to try and get your shoulder blades down and back. Muscles that we don't see, we don't really sort of think about much. Okay, if we can't see our serratus, we can't see our lower trap, we don't know they're really there. Okay, we can see our upper trap, we can see our delts, we can see our pecs, we know they're there. So we don't tend to focus on ones you can't see. This is really going to help you with the dropping down and stop it lifting up all the time. And it improves every time you move and pull. Okay, it's going to improve that shoulder blade coming down because it's attached this way. Okay, it's pulling your shoulder blade down. If this is weak, guess what? Your shoulder blade's going to pop up. So, foam roll on the ground. I don't know if you can all see me here, but on your front, put your arms out like you would do where you're going to do, say, a lat pull down. Okay, we're going to call so out on a little bit of an angle. What you do is you roll the roller via your shoulder blades. So you can see I'm not bending my elbows there. I'm not doing that. I'm trying to just move the roller by elevating my shoulder blades and then pulling my shoulder blades down to my bum. Okay, so think about those two shoulder blades going down to your lower back, if you like. So go this way to pull down and then roll up. The crucial thing for you is not doing this sort of thing and not sort of trying, oh, let's go and pull up here. It's can you just isolate. Now, some people find this really, really hard, but it's super effective in telling the brain, can you just do this movement here? That will then fire those lower traps. Because the unfortunate thing about the brain is, it's sort of the industry term is the brain knows movements, not muscles. So you can't say, lower trap. It doesn't work like that. You say, pull my shoulders down, and it'll fire the right systems, okay? If you do a too complex movement, like a lat pull down, where you've got bullies, like your biceps and your lats, and they take over, the brain has a really hard job in firing that lower trap correctly. If you can isolate it like that and say, let's not use the lats, let's not use the bicep, and force your brain to say, I just want you to pull your shoulders down, and all it's got is it goes, well, I haven't got lats, I'll use the lower trap. Then you'll get the activation. Because you can't tell your brain to say lower trap. You have to get the movement pattern that will then fire it properly. And this is where people go a little bit wrong, where they go, I'm doing my lower trap exercises, and they're bending their arm. They're going, it's not really going to isolate it. You've got to then really focus on getting all the other muscles not working so you can just work on one. That's why you asked about the extension, all that stuff works. That's why it's really helpful to do those components. Okay. Last one is scaption. Now, very difficult to do when you're injured, but great to do when you're not. So, this one is working on straight strengthening in the rotator cuff. But I'm also trying to, I might just go down to one today. Also working on, can I work on not elevating my shoulder too much? So when I lift my arm up, I don't want to be doing this. Okay, so I'm going to try and teach my brain, can I keep my shoulder blade down for the first part of the movement to about here, and then I can let it rise. We're trying to teach ourselves stability of the shoulder blade and strengthening of things like bicep tendons and supraspinatus muscles, okay, at the same time. We're not just strengthening muscles, we're teaching stability. So if I just lift like this, I'll strengthen my rotator cuff, but I'm also going to stuff up my movement pattern. So I need to have it down, and I don't want to be straight ahead. I want to be out in that 30-degree plane out there. scapula plane. Okay, so it's not straight ahead, it's out here. And when I lift up, the shoulder blade stays down for at least 30 degrees, if not 60, and then I can let it lift. And then when I come down, I've got to make sure my shoulder blade comes down and doesn't stay popped up in the air. All right, so it starts here and stays up, and then as my hand goes down, I've got to then come down. I'm teaching my brain movement patterns as well as strengthening. Okay, and a really nice one to do. One we give in the clinic when people have got injury, depending on their injury and the level of how sore they are will determine what we do with them. Okay, but a good one for you to do at home or in the gym to try and work on the front part of this shoulder. Okay, so that's my sort of way I would do it as far as putting into categories. Like I said before, rather than giving you, here's 9 exercises and you don't know which one to do when, but also some people will just start focusing on the favourites and go, oh, I did 6 of them, but I forgot the other 3. You know, this will give you like, just do 3 and do them on this day because they're the best ones for that movement pattern. Of course, these 3 also are great for pushing day, all right? But for this sort of purpose, we want to separate it out, okay? Because I don't want you doing 9 on one day. Best thing to do, use those rehab exercises in your workouts, okay? So pick a day, do 3 exercises as a warm-up routine. Do all the sets and reps, right? That's how you're going to get it done. Because most people, unless they're in rehab, won't just do rehab itself. They'll get bored of it. They go, oh my God, it's rehab day, oh, faggot. I can't be bothered, right? But if you do as a warm-up, at least you're going to get it done. It doesn't have to be every single time you do it. If you're not injured, but you've got some movement problems or you want to keep your shoulders strong, maybe it's once every 2 weeks. Maybe it's once a month. There might be a bit of a stretch. It might not be enough. But it certainly isn't every day like you do when you're injured. All right? Look for the potential problems. When you're working out, when you're exercising, when you're looking in the mirror, is one shoulder blade not looking like the other? Is it not moving like the other? Do you have pain in certain positions when you move? Is it doing funky things? Have you lost range? So all those things we went through, are you ticking any of those boxes? And if you are, and you're getting pain, and you can't fix it with those exercises, that's when you go and get it assessed. Okay? Get in to see someone like me, or Pam, or Kristen, to see what is going wrong with my shoulder. I've got some pain here, it looks funky, sometimes the exercises hurt a little bit. Okay, we need to look at that before it becomes a problem that stops you altogether, and then you're going to go through months of injury and stopping gym and all that sort of thing. Okay, so like I said, this is injury prevention to try and stop you getting injured. That's our big goal. So, have you guys got any questions specific to this? Yes, Edna.
This is, my problem with this.
Hand behind your back. Yep.
And a friend rather crushed me by saying, can't you get your hand behind your back? No, isn't your shoulder fixed?
Yeah.
And I said, well, you and the surgeon said it could take a year.
Yeah, 2 even. Yeah. But did your friend have a shoulder replacement?
No, she said a knee done.
No. And did you ask your friend, how's your knee range going? Why is it not like this? Right? Yeah, because I'll guarantee it's not. I'll guarantee it's like this, not that. Right? Because when you change a joint anatomically, like you've had, and this is not any sort of simple surgery, this is full-on replacement surgery, you don't have a ball in the socket that looks beautiful like you did when you were 20. You have a changed ball in the socket that's actually reversed around the other way and has limited range. They can't completely replicate it. Maybe in 100 years with AI and stuff they will. But they can't get it absolutely perfect, so there's limitation in range. And they do that to keep it stable because your rotator cuff is not holding that together very well anymore, so they have to make that shoulder super stable. Therefore, you can't get all this beautiful range that you'd love. But you won't get it 100% like you were 22. But in time, some people actually get it better than their other shoulder, the older they get. Because the other shoulder is wearing out, and the new shoulder is actually outperforming the old shoulder, right? And so if you go year 1, you may find year 2, with all the millions of movement positions you do, the body adapts. It's very clever at adapting. You say, I want to do this. It'll go, okay, well, I'll let it stretch out a bit more and we'll move a bit more. And you may find you've got another 10 degrees, 15 degrees in there that is yet to come. But certainly in your first year, you wouldn't ever go, is that all I've got? Not a chance. It's the same with knee surgery we've had, same with the ACL, same with my recon. This shoulder did not feel right in the pull till year 2. It took me 2 years. But I was 85%, 90% at year 1. But to get that last little bit, so I can do all this, it took another year of just lots and lots and lots and lots of movement. And it's slowly adapting. It adapts enough in the first bit, but then you need to keep working on. That's why this stuff's really important for people to keep going. Even after, they have their injury, have their surgery, they've got to keep going. Yeah, and if they don't, they have problems. Yes, Ross.
There's 3 lots of 3, so there's 9. Are you saying you choose one lot of the 3 that was on the same muscle group? Like within push, we focus on those 3 on one day, or we do one from each type?
Try and focus on the 3 if you can.
One type.
Yeah.
Okay.
You could spread that across the week. Yeah, but I'm only doing those exercises once a week. Okay. If you do, yeah. Some people are training 6 days a week. Okay, well maybe you need to do 1 on one day and 2 on another, rather than 3 on one day. But it's pretty easy to do 3. It'll take you 10 minutes. Like, it's pretty easy to do. And if it's only once every couple of weeks, it's not too bad to do. But it's your warm-up routine. A lot of people go to the gym and go, they use their first set as their warm-up. Well, why don't you use these exercises as your warm-up and then go into your first set a bit better? It's just time. This is what it takes. And us as humans don't have time. And this is where we fail in shoulders and rehab, because we don't put enough time into it. And I always say to people, you've got enough time to go to the gym 6 days a week. And you're prioritising that. And you're there for an hour. So you can't do that. And it's just it's their priority.
And with the internal rotation and the external rotation, can you use a 1 or 2 kilogram dumbbell?
You can swap it, yeah. These are just examples of using bands, simple things at home. Some people don't have dumbbells at home, but a band's really easy and you can transport it.
There's no way to put the band at home, really.
Doorknob, coat hook. Even sliding doors. You got a sliding door to the balcony, wrap it around that. I've had some people go out the balcony, just drill in hooks into their balcony, and then there's their attachment that's permanently there. And they can do their exercise in the balcony. You'll find a way. Small child, maybe, they can hold on to it, something like that. But yeah, think of it as like trying to keep consistency with that. Yeah. Anything else? Yes.
I want to ask, is shoulder press actually a healthy exercise at all?
Absolutely. Yeah.
It is.
For some people, the military press is not, where they're going very vertical. But a shoulder press, yes, it's a normal human movement.
Both hand 180 degree on the top is.
What's probably more safe is a single arm dumbbell or kettlebell than a fixed bar. The fixed bar will force your arm into a position. Like, you cannot change your hands when you're moving up. Whereas if I use a kettlebell, when I press, my brain will move this bell in the path of least resistance. Does that make sense? So when I push up, and I don't think about it, my brain will put that in a position where it's most comfortable. All right? Whereas a fixed bar, I can't adjust at all. Okay, I can't move it right. I can't adjust as I go. I might start off here, and then my brain will slowly start going, no, you need to be over there. But if you have a fixed bar and it's just pushing, you will be able to push more load than this, because I can only push what I can hold in my hand. Whereas a bar, I can rest it, I don't have to grip. I can just press it up. Okay, and I'm stable. So this is why people who want to grow muscle, bodybuilders, get bigger, get stronger, more powerful, yes, a bar will do that for you. But that is a safer option for shoulder injury prevention. Doesn't mean that the bar causes injury. It's just that it's not as safe as that. And a lot of people go through life just pressing and they have no problems because they've got shoulder mechanics. But if your shoulder mechanics are a bit off, then that's when you can start running problems. And we get people in here from doing shoulder press. It's not necessarily that the bar and the weight and the load is causing their problems. It's because they're being forced into a position that maybe their body is not actually coordinated or that good at doing.
That started my problem.
Yeah, okay. But we, it's like that age-old question, like, well, this is what's going to grow muscle. Yes, well, but when you want the things that give you more load and more muscle, you're closer and closer and closer to things that are maybe causing you injury. Okay? Because I can only hold what's in my hand. The other thing about the bar is it gives you stability. When I've got 2 kettlebells here, it's harder for me to control it. Okay? So I use up my energy controlling the weight. Right? So it's not as effective if I want to build muscle. Right? But it's very effective for some athlete who lifts overhead and does throwing and shoulder movement. They need the stability. They might do sets where they're doing presses to gain the strength, and then they might do sets with the kettlebell because they want stability. And they might do things like this where they do an upside down kettlebell, which makes it more wobbly because that's what they need for their sport. They need to be able to throw a ball and have good control. They're not going to get that from just doing a barbell presses because that bar is fixed. And so like when I've got 2 feet on the ground, that is fixed. This is way harder, isn't it? Right? So when I have a bar fixed, it's so easy. Like, this is a piece of cake. And that's like, oh, that's harder from the same weight. Does that make sense? Yeah? Good one. Hope you enjoy yourself. No worries.